Sarah, can you believe it? I'm almost to the finish line of this dental hygiene program. It's exciting.
I know, Debbie, it is exciting. I would hate to be a Debbie Downer, no pun intended, but as your friend and hygienist, we should chat about burnout, especially with COVID here.
Uh-oh, what's that supposed to mean?
Well, don't let me scare you. Let's chat about it a little bit more.
Hi, I'm Debbie Diaz.
And I'm Sarah Stevenson, and this is
Dental hygiene burnout.
And the Invisible Burden, COVID 19.
While career opportunities in the dental hygiene field often surpass those in other specialties, researchers aim to examine issues surrounding job satisfaction, turnover, and burnout. The objective of this research is to explore key determinants of burnout, both prior and during the COVID-19 global pandemic.
Burnout is the end result of an attrition process in which driven individuals lose their motivation. It is fatigue on all levels: physical, emotional, and mental. Professional burnout is an outcome of continuous stress. Emotional and mental weariness, depersonalization, and a lack of personal accomplishment are all symptoms. Susceptibility to burnout is prevalent amongst dental hygienists.
Physical stressors in dental hygiene can lead to symptoms such as headaches, lower back pain, eye strain, muscle stiffness, gastrointestinal issues, and lack of sleep. Research suggests that in the dental hygiene field, emotional exhaustion is a result of the pressures brought on by work overload, a lack of recovery time in between patients, and a relational disconnect between dental staff and patients. Clinical and patient depersonalization can occur among dental hygienists due to a lack of rapport, as well as repetitive tasks and uncooperative patients.
Research has proven that dental hygiene is the most at risk profession for exposure to pathogens outside of the hospital setting. It has been shown that perceived exposure is positively correlated with COVID 19 related worries, social confinement, and traumatic stress. Because of the pandemic, many in practice are concerned about workplace safety precautions, while others have chosen to resign indefinitely. Other contributing factors include childcare shortages and the risk of spreading infection to loved ones. The COVID 19 pandemic has also given rise to occupational dermatosis, most commonly xeroderma, pressure related erythema, and contact dermatitis.
We conducted 2 online surveys to gain a comprehensive understanding of this information. Both surveys were distributed to dental hygienists currently practicing in the clinical setting. The first survey asked 214 respondents about general causes of burnout, while the second survey asked 322 respondents about additional causes of burnout stemming from the pandemic. Close to half of participants expressed emotional hardening towards patients and coworkers, and more than half associated the repetitive nature of the job with feeling depersonalized. The majority of respondents agreed that they often consider looking for a new career because of physical or emotional fatigue.
Unfortunately, most participants expressed neutrality or disagreement about patients' implementation of oral hygiene home care. The general and distinct concern about the risk of physical injury in the profession was the most notable implication of results. Despite that, almost half of respondents would not have chosen a different career if given the chance.
Apart from general stressors, the pandemic has added new stipulations to the profession, resulting in even higher rates of burnout. Responses indicated that dental hygienists are largely in agreement with current CDC COVID-19 guidelines for PPE use. However, wearing expanded PPE comes with some downfalls, and most hygienists surveyed stated that they have experienced discomfort and even injuries from wearing extra PPE. It was surprising to discover that almost 2/3 of the respondents did not report increased anxiety during the pandemic.
With vaccines being a hot topic lately, a bulk of participants stated that patient vaccination status has zero influence on their level of compassion and willingness to provide treatment. And though unanticipated, more than half of the respondents did not agree with the COVID 19 vaccine mandate for all healthcare workers.
Sarah, with COVID here to stay, there's a lot I hadn't thought about that you touched on today. I think that mental, emotional, and physical health education for dental hygienists prior to entering the field is critical in preventing burnout. Additionally, the use of ergonomic equipment and frequent stretch breaks are methods of injury prevention.
That's right, Deb. And to add to what you've mentioned, the application of moisturizers and proper N95 mask fittings can help combat PPE injuries. It could be helpful if regulation was developed and implemented, requiring employers to provide mandatory intermittent breaks to clinicians so that they can remove the PPE and allow their body to rest. Hygienists can also expect healthcare policies to undergo continual change while the campaign against COVID-19 progresses. There is a possibility that PPE regulations, such as mandatory wearing of N95 masks, could become the new standard.
With increasing healthcare standards, it's also critical that employers not lose sight of the importance of clinician autonomy and a supportive work environment. Turnover rates could be improved by workplace health promotion programs that target the physical and psychosocial environment. This conversation was so necessary because now I feel better informed on burnout prevention. I'm so grateful for your insight.
That's what friends are for. You're going to be a great hygienist, Deb.
I'm just following in your lead, Sarah.
We hope that this research will help employers and aspiring dental hygienists to recognize occupation-related stressors to prevent
Dental hygiene burnout.
and the invisible burden, COVID-19.
We would like to thank you for your valued time and attention today.